Hello, everyone. Welcome to our Facebook Live Marathon. I've been doing Facebook Live regularly, trying just to get the word out and help and reach more people in this process of recovery. So if you don't know me, I'm Dr. Bill Rawls. I've been a physician for 30 years, but half of that time has been spent with fibromyalgia, chronic Lyme disease, chronic fatigue, illnesses that people feel a little bit abandoned by the regular medical community because these things are so ill-defined and because treatment for them in conventional terms is so lacking. I have a strong interest in these things because my career midstream was derailed with what I defined as fibromyalgia in the beginning, and later found that I was carrying some of the microbes that are associated with Lyme disease. Now I see all of these things as somewhat together, very unique. So this is what we're talking about. I'm answering questions. 3 hours, a full marathon session. As long as people ask questions, I will be here trying my best to answer questions. So come and join us and send your questions out there. Now, I'll tell you right up front, I can't answer questions about specific personal medical problems. That being said, everybody wants to find out about themselves. So if you can pose questions in a hypothetical way that I can answer it more generically, that everybody is going to benefit, that could really be helpful. So there are a lot of things to talk about. We can talk about microbes. We can talk about mitochondria. My favorite topic is herbs. Questions about herbs are certainly very, very welcome. And so this is very informal. I'll be taking time to read questions as we go along, and we'll just stay at it as long as people are interested. So let's see. First question this morning is from Jay, interested in recommended treatment for chronic EBV in a patient with mixed connective disorder. There are a lot of names that we've come to associate with these ill-defined disorders that all have very, very similar symptoms. Fatigue is one of the top symptoms. Pain in muscles and tissues, anxiety, depression, neurological symptoms to a strong degree, just feeling horrible, feeling viral, just feeling miserable. So there are a lot of different names that describe subsets of people. So mixed connective disorder is one of these things that fits in this category. And we're talking about here a microbial connection, Epstein-Barr virus. I think most everybody has heard of Epstein-Barr virus now. It's the cause that is associated with mononucleosis, getting mono. But the fact of the matter is that 95% of the world's population ends up getting Epstein-Barr virus. Most people get it when they're kids. If you don't happen to get it as a kid, if you get it as a kid, it's a very mild infection. You don't even know you get it. But it stays in your body. It never leaves your body. It stays present in different white cells called B cells and other cells in the body. And you never get rid of it. So if you haven't gotten it as a child and happen to get it like when you're in high school or college, that's what mononucleosis is, and it's much more severe. But what happens with a lot of people, though, is if you have your immune system depressed, then you can have reactivation of Epstein-Barr virus. But what I'm finding is when you look at acute illnesses, like mononucleosis is an infection with Epstein-Barr virus. No doubt about it. And the Epstein-Barr virus is affecting the immune system directly, and it's an acute infection. When you talk about chronic infections, that we're starting to make these connections with microbes, There's so many microbes. I have a list of well over 100 bacteria, viruses, protozoa, fungi that I've been compiling now that can cause some of these chronic infections. Typically what we're finding is it's not one microbe. And that's a lot of the new research that's coming out. So what happens is if you have something like chronic fatigue syndrome or a mixed connective tissue disorder, and researchers are looking for Epstein-Barr and they find positive Epstein-Barr, they make that connection to say, well, it must be because of the reactivated Epstein-Barr that these people are sick. But the problem is they're not at the same time necessarily looking for a lot of other potential microbes like chlamydia, mycoplasma is high on my list, and things that could be happening at the same time. So whenever I see these things, whenever I see reactivated Epstein-Barr, someone that's had it in their system and then it becomes active again and it seems to be connected with the symptoms, I'm associating that with chronic immune dysfunction, that things come together, stress factors, so many things in life that hit us and depress our immune system. A big part of that is just the world we live in. We are living in the age of chronic immune dysfunction. The foods that we're eating depress our immune system, all the processed foods. Toxins. This time of year in the winter where we are, if you go out on a cloudy day in the wintertime and walk by a highway, you'll be really astounded at the concentration of toxins coming from cars. We don't get it in the summertime or on a really clear day because it passes out in the atmosphere, but a cloudy cold day will hold it right down by the road. It can be very uncomfortable. But we're getting all this stuff in low quantities, and we're not supposed to. This is new stuff that's really affecting us. Chronic stress, being inactive, just sitting all day. All of these things are affecting our immune system, and I think that's what ties these things together. So which spectrum of symptoms that you might end up with, whether we call it mixed connective tissue disorder or fibromyalgia or chronic fatigue, depends on the spectrum of microbes that you've picked up in your life that happen to be present. So it's not just Epstein-Barr. It's, Mycoplasma. There are many Mycoplasma species. And this is another one you don't get rid of with antibiotics. I found a study that 40 to 60% of the children encounter Mycoplasma, and the vast majority of them keep it in their body for the rest of their lives. That's 40 to 60% of the population. That's huge. These are just a few. We're just scratching the surface here. There's so many microbes that can do this that it really, really is remarkable. So let's see what other kinds of questions we've got here. And let's see, who's joined us this morning? Will Dawn asked, do you have a clinic that I see patients? I am not at this time. I'm taking a sabbatical to really put together research. I'm spending a lot of time doing research and writing. I spent a good part of a 30-year career doing clinical work, spending time in the office. And what you find is you either do that full time or you don't. It's very taxing. And at one time, I was trying to write, research, and recover myself from fibromyalgia and chronic Lyme disease. And it was too much. So now my concentration is mainly on research, and that is really the really important research I'm doing is making the connection between these intracellular microbes, viruses like Epstein-Barr, Mycoplasma, Borrelia with Lyme disease. All of these microbes have common characteristics that they live inside cells, and that makes them very unique in how they affect chronic illness. A lot of new studies coming out, really just loads of them in the past 2 years that are pulling all this information together. So, I started with a theory 10 years ago that it wasn't just a microbe causing an infection like Lyme disease, that it was a spectrum of microbes. These things that we're calling co-infections actually is much broader than the few that are being tested. And that in association with chronic immune dysfunction is why people are getting ill. All of that information is coming together, and it's really exciting. So got an upcoming webinar about pain in a couple of weeks. I've spent the past 2 weeks reviewing over 70 different studies that have been published in the past 5 years that pull all these little pieces of information together. So I'm putting all of that together right now. I want to do some more beyond the webinars and all the other content that we're doing. We're trying to reach as many people as we can. In an office, I can speak to 1 or 2 people at a time. I might see at the most 10 people in a day. Here, I can speak to so many people with webinars and all the other information to give people the information they need to own their own recovery, to become proactive, and that's what this is all about. At the future time, I may go back into clinical medicine, but I've got some big things that I need to do first. Karen asked, chronic Lyme, disabled 25 now with adrenal fatigue. I keep my diet, but still need help. These pathways, when you change your perspective of what chronic illness is and start looking at it differently, then you open new doors toward recovery. And from a conventional medical point of view, we tend to not look at the causes of illness, but instead the processes of illness. And I think this is a really important distinction. We're not looking at why people become inflamed and why they have symptoms. We're looking at the inflammation. We're looking at the processes that are going wrong in the body. And we try to treat those processes with drug therapy, which is artificial and limited in a lot of ways. It works for acute illness. It doesn't work very well for chronic illness. And that's a huge problem in how we approach. So when you walk in the doctor's office, now physicians really don't have a lot of time to talk to you. They list your symptoms and they're looking for the diagnosis and the drugs that might treat that diagnosis. But across the board, the drugs are going to treat the processes. They're going to inhibit the abnormal processes, which might decrease symptoms. But what I found to be almost universally true is that drugs have the ability to manage illness. Drugs seldom have an ability to actually restore wellness. If you want to restore wellness, if you want to reach a state where the body is functioning properly, you have to ask different questions. And that's what changed my recovery. Is I started, when I was in my late 40s, my life was really completely compromised by every symptom that you could define, from fibromyalgia and chronic Lyme disease. I identified more with fibromyalgia than I did chronic fatigue, because even though I had severe fatigue, I had a lot of pain and pain and pressure points, pain throughout my body. So that seemed to me more logical. If you overlap the symptoms of chronic Lyme disease, or what people are defining as chronic Lyme, and fibromyalgia, it's almost a complete overlap. So But everybody wants to find the cause, so you search for the microbes, and so they're there. But I think if we really had the capabilities of better testing, I think we would find that everybody with fibromyalgia also had a range of microbes. Not the same in every case, but always microbes present. And so the microbes are part of the puzzle, but not a microbe, this spectrum of microbes. We're finding that our microbiome is very, very complex, that it's not just confined to our gut and our skin as once thought. We are finding that there is a microbiome of the brain, that microbes are present in muscle tissue, in heart muscle, in liver, in spleen. All these places we're finding microbes that we didn't think microbes were present. And what we're finding in disease states is that the spectrum of microbes is shifted, that there are more pathogens, there are more activity from intercellular microbes like Epstein-Barr, that there's an imbalance there, and that's affecting everything in their body. So it affects all of our tissues, and it drives our brain in a way that activates our flight or flight response chronically. That disrupts hormones. And so when you look at illness, it's a disruption of the communication pathways in the body. So adrenal fatigue is part of that. This whole syndrome is disrupting communications in the body. So if you try to treat adrenal fatigue with drugs or even natural therapies, in exclusion of everything else going on, you just don't get anywhere. So you got to look at that big picture. You've got to have this comprehensive approach of looking at the total body from top down. You've got to look at what I call the 5 elements. Top of the list are the microbes, but it's the spectrum. It's the disruption of the entire microbiome, not an infection with a microbe. You got to look at diet, and the gut is so important. What you feed your microbes in the gut is really important. So it's well known now that microbes in the gut produce neurotransmitters. They produce a wide variety of new neurotransmitters, including serotonin, GABA, glutamate, and a series of other things that can either be calming or activating. And so what happens is, if you are feeding your gut bad food and you have stress and your gut isn't working properly, then you cultivate a flora that is exciting, it's stimulating, it's agitating the body, and that agitates the brain. So you get anxiety, you get a lower pain threshold. So all of these things work together. If you're agitating the brain, that's what affects the adrenal system. We talk about adrenal fatigue and adrenal hormones. The adrenal gland is just a gland, all right? What you're really talking about is problems in the brain. The brain is producing substances that are driving the adrenal to the point that it becomes fatigued. So getting back to those basics, changing your diet, taking herbs to suppress microbes, changing your approach to life. So many of these things can really be valuable in that total recovery process. So let me scroll down here, and see who else is here. Jenny is here. Let's see. Karen, let's see. Getting a lot of questions. Good. Reset for newcomers. Oh, yeah. For everyone who is just joining us, this is Dr. Bill Rawls. We're doing a marathon Facebook Live on the topic of just chronic illness in general, but especially chronic fatigue, fibromyalgia, chronic Lyme disease. But I'm really open for most questions. Again, I can't really answer personal questions, but if you can frame it in a more hypothetical point of view, then that I might be able to help out. So let's see. So what do you do for tooth and gum issues even after taking, I assume you're talking about like gingivitis and tooth issues. Root canals are really common source of ongoing problems because people can get bacteria down in the roots. And herbal therapy really has a long-term herbal therapy will help suppress microbes. That's one thing that I've noticed, that good diet, good health habits, but taking herbs really does affect your gums in a positive way. I've always been fortunate with good teeth, but while I was frustrating with chronic illness, did start getting gum irritation, and I embraced herbal therapy, changed my diet, etc., and the gums got better. So it's when you get away from trying to treat specific symptoms and try to treat the body as a whole. When the body is functioning like it should properly on a high level, then you really do some amazing things that all the symptoms just basically go away. So let's see. Evie asked, what is your experience with treating Babesia? And how long does it take? And will you ever get rid of it? It's Babesia. That's a common co-infection, and it's one that we're finding is really common. It's an interesting microbe in that there aren't that many protozoa that we recognize as causing illness. Probably the most common one is the one that causes malaria. And interestingly, Babesia is a distant cousin of that microbe. But it's not nearly as virulent. When I started hearing about Babesia as a co-infection, it was somewhat surprising to me, because when we were in medical school, they mentioned Babesia, but really in passing. It was almost like a footnote that it was this distant cousin of malaria that really doesn't make people sick. And interestingly, that's true in most cases. Most people that acquire Babesia from either mosquitoes or probably more commonly ticks don't get sick. They carry it. They can have it. It can live in your liver, and you can carry it for a lifetime and never be ill. But it can cause very severe illness in the same respect. I think it is not Babesia by itself that's causing illness, but again, this boiling pot of chronic immune dysfunction that comes together, and it's not one microbe, but it's the multiple microbes together, and all the factors that come together to build out this perfect storm of immune disruption that allows this thing to flourish. Classically, if you have chronic Babesia, what happens is you go for periods of time, weeks or months, where you feel fine, that you're not sick at all. And then suddenly you have a relapse of the acute symptoms with fever and just the chronic misery that's like an acute infection, which is how malaria works. People can go for a long time without having an outbreak, and then suddenly they have terrible fevers and are miserable. But Babesia typically doesn't cause symptoms that are quite severe. What I'm finding, though, the deeper I go with this Lyme disease thing and the more I follow it, is an awful lot of people are testing for Babesia and they're curing it, but they're not having the classic symptoms. They don't have episodes that they go for a while and they have no symptoms, and then suddenly they have just an outbreak of fever. It just seems to contribute to the general misery that people are having. Like so many other of these microbes, Babesia is an intercellular microbe. It lives inside cells. It stays chronically in the liver. Antibiotics do a really poor job of getting rid of it. Most of the antibiotics used for Babesia are really potent and have some fairly potent side effects that come along with it. So it's, I think for most people, herbal therapy is a good option. Fortunately, there are many herbs that have effect on protozoa. In fact, most of the herbs, I would say half the herbs in use right now have historically been used for intestinal infections of protozoa and other kinds of parasites. So the ones that we use in our formulas, cat's claw and andrographis, are both well known for affecting protozoa like Babesia. Outside of that, there are many others. Cryptolepis is probably top of the list, is one that has a wonderful, good effect. Artemisia, some of the classic herbs used for intestinal infections like Artemisia, black walnut, can have some effect on it. So there are a number of herbs that can be used. So let's see, what else have we got? So let me see, Karen's passing me a question here. Is there any research showing, Garden Girl asked, is there any research showing good results using full spectrum CBD oil for psoriasis, mold exposure, or chemical exposure, either taken orally or applied topically? So those are a little bit independent. So we've got psoriasis, mold exposure, or chemical exposure, of which those are three very different things. And I'll say up front that, yeah, there are a lot of things that are good for psoriasis. And it was really interesting. Years ago, I did I had a health program with weight loss in my office, and I noticed that there are a number of people that had severe psoriasis, some of them that were on some potent immune suppressing drugs. And when they completely changed their diet and embraced herbal therapy, all the psoriasis completely went away. So, that suggests that it might have an effect, but then there's a question of, well, why does it have an effect? So if you really dig deep into what causes psoriasis, there's a very, very close link between dysbiosis, imbalances in bacteria of the gut, and bacterial die-off from those bacteria. In other words, bacteria dying off from this overgrowth of bacteria in the gut causes inflammation in the systemic system, which translates into these skin reactions. And interestingly, one of the herbs that has been used historically for psoriasis has been sarsaparilla. And you may recognize that sarsaparilla is one of the herbs that we use for Lyme because it binds endotoxins. It binds dead bacteria and helps clear them from the system. So it's interesting that all those connections came together. Now, as far as CBD helping it, sure, CBD has some really nice effects on calming the immune system. It oversees the immune system, and so it really can have some very, very nice effects on improving psoriasis as well. But I think any of your herbs, any of your antimicrobial herbs, certainly with sarsaparilla is top of the list, then that is really important for psoriasis. But that being said, if you keep doing the same diet and really don't clean up your diet as far as processed carbohydrates and that sort of thing, nothing is going to really fix it, because you got to go to the source. You got to figure out, well, what's causing this total problem. So we would also expect herbs that affect the gut flora, top of the list being berberine and berberine containing herbs, to also have a positive effect on not only gut function, but also psoriasis. And I've seen that in my practice, which is very important too. Mold exposure, CBD is going to help with the symptoms of mold exposure, but the only thing that's going to really help with mold exposure is isolating yourself from mold. There's a lot of mold out there. We find it in our homes. We find it in our food. But if you're continuing to get mold toxins, mycotoxins, then that can really affect a lot of things about how you're feeling. So you got to get rid of the source of the mycotoxins. There's a lot of thought that you never get rid of them out of your body, that they keep circulating and you have to do all these special binders and that sort of thing to get rid of mycotoxins. I don't buy that. I was stuck in a moldy building for several years, and I was miserable during the week when I was in that building. But boy, when I went on vacation for like a week or more, my body would clear the toxins pretty rapidly. And I'm very, very mycotoxin sensitive. So I really don't, I think just a really good diet with lots of vegetables, you're going to gradually clear those mycotoxins from your body. Other kinds of toxins, same thing. I mean, you got to get rid of the source. You got to clean up your food. You got to filter your water. And just being really vigilant about air inside your home and when you're going outside. All those are important. Now, we'll probably get more questions on CBD, and I welcome them because that's a really hot topic right now. But, it is one of those things that, I think it's on the list, but I wouldn't put it as the primary for those things. So let me see what we've got here. Looking down the list, we're getting a lot of questions. Give me a minute just to scroll down here. Here's a Mycoplasma question. That's always good. Stephanie Fisher asked, does Mycoplasma complicate the disease and treatment of chronic Lyme, Bartonella, and Babesia, and how is it best addressed? Mycoplasma is part and parcel of the whole thing. There's very little doubt that it's part of it. When you look at the incidence of Mycoplasma with Lyme disease, it's at least 75%, maybe even higher than that. A lot of people consider it a co-infection. There is evidence that some species of Mycoplasma are transmitted by ticks, but I wouldn't consider it a classic co-infection because most people have it before they get sick. Again, Mycoplasma pneumoniae, it's a bacteria that's associated with walking pneumonia. Mycoplasma is another one of these intercellular microbes. It's actually the smallest known bacteria. It's remarkably small. It can't live outside cells. It is an obligate intercellular. It has to have cells to live inside to be able to thrive. So its whole genome is designed to manipulate the host cells, and that's what it does. So it's a really interesting microbe, and I think it does play a role in many chronic illnesses. And definitely plays a role in Lyme disease. But I think most people are picking it up as children, and it's in their system. And there are varieties that you can pick up from intimate contact with other people. And I think that is much, much higher than most people realize. I think it may be one of the highest microbes that can be passed by sexual contact. But we typically are only looking for a couple of species. There are dozens of species of Mycoplasma that can affect humans. And it's, I think we're really just scratching the surface in the role that it plays with chronic illness. I recently found a study that they had found that 86% of people with osteoarthritis. Now, this was felt to be a non-microbial arthritis. 86% of people had mycoplasma in their joints. So this is a really, really common microbe. The thing about it is it doesn't cause illness in most people. Most people carry it. So it gets back to that chronic immune dysfunction. So it's not the one microbe that's causing problems, it's all the microbes together. And I think, again, with the chronic Lyme thing, we're really just scratching the surface. There are a lot of different microbes that affect us, and it's much bigger than we think. So I think we've got another question. What is the best course of gut healing? In Little ask. And do I need a stool or microbiome test? Most of the time, most people don't need extensive testing like stool testing. And the concept of microbiome testing is still in its infancy. In other words, passing, giving a stool specimen, having it sent off, and having the entire microbiome of that stool analyzed. There are problems with that because some things in the sample, just in the time that it's transmitted, some things are growing, some things are not. So even by the time it gets to the lab, it's going to be a little bit skewed. And quite frankly, we just don't understand it very well yet. 30 years ago when I was in medical school, it was thought that the gut had 300 or 400 species of microbes. Now that count is upwards of 20 plus thousand species of microbes in our gut and in our body. And every person's microbiome is just a little bit different. Our microbiome is more unique than anything about us. If you've got identical twins, you've got two people with identical sets of genes, but their microbiome is different. So every person on the face of the earth has a different microbiome. So we do know certain things, though, and how you feed your microbiome in your gut is really, really important. So you really need to feed your microbiome the things that your body, your gut is used to cultivate. It's like a garden. You have to cultivate these microbes. So if you're eating high carb processed foods that really haven't been a part of the human diet, you're going to affect those microbes adversely. If you eat a lot of meat, you're going to have a totally different spectrum of microbes than if you eat vegetables. What I've come around to finding that is the best diet for really, really cultivating a good gut microbiome is about 50% vegetables, some meat, but I think a heavy concentration of meat fat disrupts the microbiome and increases risk of colon cancer. So healthy sources of protein like fish and eggs and some vegetable sources of protein. Good fats like avocados are really, really important just for keeping a healthy microbiome. So diet is number one. Herbs are number two. What I found is that herbs are really, really important for cultivating the proper balance of microbes in your gut. Much more important than a probiotic. We're still learning about probiotics, and what we're using for probiotics now are just the same microbes that we would have found in fermented foods, because we don't eat quite as much fermented food as we used to. But it's really hit or miss. I've found that herbs are on the money just about every time. It makes sense if you think about it. For 200 plus thousand years, humans ate foraged food. It didn't have any grain or beans in it, but it did have a lot of vegetable matter. In most places on Earth, humans ate about half to 2/3 vegetable matter. And if you look at that vegetable matter, it was stems and leaves and roots and bark and wild berries. It was essentially the same thing that we define as herbs today. Our herbs come from stems and leaves and barks and roots of wild plants. So that's what humans were eating for hundreds of thousands of years. They had a much greater microbe burden than we do because they ate off the ground and their food was contaminated with so many things. But what kept them alive was the fact that they were getting all of these robust chemicals that I call phytochemicals from all the plant matter that they were eating. And when we started eating grains about 10 to 20,000 years ago, we started selectively removing those forage foods from our diet. And now even our good diet, loaded with vegetables, doesn't have the concentration of phytochemicals that was in that ancient forage food diet. Now, this isn't necessarily a suggestion for a paleo diet. I think we have adapted to grains, and some grains are well tolerated. Half the world eats rice. The highest life expectancy in the world is Japan, where they eat rice every single day of their lives. But these high concentrations of processed food from corn and soybeans and wheat and rice to a certain extent, it's the processing that's really messing it up for us and messing up our gut flora. So if you're really eating a good diet, if you're taking herbs, if you're doing the things that you need to do, and you know, we've set up some really nice protocols and programs for people to follow. Generally, you don't need that testing. Stool analysis cost $600. I used it in my practice for a while, and I found that just talking to the patient and understanding the patient was much more important than what the stool analysis gave me, which was often just hit or miss. And again, microbiome testing, we're just not quite there yet. I think that's a really exciting area with a lot of future, but we're just not quite there. So if you're just joining us, this is Dr. Bill Rawls. We are doing a marathon Facebook Live, 3 hours. I'm going to keep doing this until 2 o'clock today and get as many questions as I can. Lots of great information for everyone to join in. So we're just lots of questions. I've got a few folks here that are helping me sort the questions out a little bit. And so we're going to just go down the list here. I'll get to that one next. So let's see. Oxygen therapy. Let's see. Tanya asked about oxygen therapy and recommendations on an oxygen compressor, what to look for. Oxygen therapy, I consider a heroic therapy. And what I mean by heroic therapy is something that has a price, either a price in toxicity or a price is significant cost to acquire that technology to use it. And our conventional medical world focuses primarily on heroic therapies. That's what we do. When you break your leg and come into the hospital, we heroically set your leg back in place and get you back where you need to be. Works great for acute illness. It doesn't work as well for chronic illness. And the problem is that there's always a price in toxicity to pay for these things, a potential for side effects and other harm that could actually get in the way of healing. Acutely, a lot of things seem to work for healing. Chronically, you've always got that balance between how much is a therapy hurting the body and inhibiting the healing process, or is it actually contributing to the healing process in some way. There's a little bit of both, and that's true with oxygen therapy. So if you look at oxygen therapy, there are various ways that you can get it in your body. You can do ozone. which is typically done by intravenous injections. Also, it's done rectally. I don't think that's necessarily such a good idea. Ozone is a very active form of oxygen that generates free radicals. The other is hyperbaric oxygen, putting you in an pressurized oxygen chamber with 100% oxygen. And then there are other things that you can get oxygen in your body. Hydrogen peroxide, taking hydrogen peroxide orally, you can release oxygen-free radicals. So basically what you're doing is trying to kill microbes with oxygen. And there are other things that it does too, but most of the microbes that are associated with these illnesses are anaerobic. They don't like oxygen to survive, and oxygen really burns them up pretty rapidly. Can you push enough oxygen in the body? What you have to understand, though, is that what I'm breathing right now is only 20% oxygen. 80% of what's in the air is nitrogen, which is inert. And so the oxygen is a fairly low concentration. When you go to 100% oxygen, the problem with that is it's extremely toxic. It's toxic to your lungs. You can burn your lungs. It's really, really very potent to all of your tissues. So it's that balance between, can it kill the microbes? Are we forcing enough oxygen and oxygen-free radicals in our system to kill the microbes without damaging us? So hyperbaric oxygen, it's potential damage to the lungs. Ozone is potential damage to the veins and vascular system. So it's something that can be a nice complement if it is used properly. So generally what I suggest is put the heroic therapies down on the list. Do all the things that aren't toxic. Change your diet. Change your way that you approach life and affect stress. Take herbal therapy. Do all of these things that are non-toxic, that have this wonderful restorative value, that don't have the price of toxicity. And then if you're not getting there, use the heroic therapies like hyperbaric oxygen or ozone therapy intermittently. So I've met so many people that have used these kinds of heroic therapy, hyperthermia, hyperbaric oxygen, all of these things as primary therapy. That's basically all they're doing. They're not doing all the herbal therapy and other things. And they get it better for a while, but then they go right back, and then they have to do these things over and over and over. And the more they do them, the less effective they are, because they're building up toxicity to these things. So put things in perspective. I like to use a little triangle that you should be thinking about it in this way. So restorative therapies are your foundation. That's really important. But symptoms like pain and fatigue can get in the way. So sometimes treating symptoms with drugs or things like CBD is really important. And then save those heroic therapies for just when nothing else is quite working, or if you want to accelerate your recovery. So let's see. Marlu asked, the extreme fatigue of Lyme is like being sedated. What's the specific mechanism behind this profound fatigue? Yeah, I did a webinar, and it's probably still available if anybody's interested, just on fatigue last month. And that's a really interesting topic. And I think it's important to ask that question, what's causing the fatigue? Where is the fatigue coming from? What is the root? And you can look at the mechanisms of fatigue, and that's one thing. But when you get to the causes, it always gets back to those elemental causes. But I looked at two different categories of things that were contributing to fatigue that I thought were really important. Mitochondrial dysfunction Sorry about the writing. It's hard to write on the board. And then disrupted communications. These are good questions. I think they're really important because when you look at illness, these two things are so remarkably important, especially when you look at fatigue-related illnesses. So you can think of the body as a complex biological machine. It's not, our car has an engine that drives all the different parts of the car. And that's how the car works. Our body is very, very different. Our body is a collection of cells. We have roughly 10 trillion different cells in the body. And each one of these cells is like a separate engine. And all of these cells, all the functions of all the 10 trillion cells in the body have to be coordinated for the body to work properly. So for that to happen, you have to have these two things. Every cell in the body, all 10 trillion cells in the body have to have energy. They have to be powered. And they get their power from mitochondria. Mitochondria are so remarkably important for powering each one of our cells. But even if the cells are powered, if they're all not communicating, if they're not communicating together, then you have dysfunction. There's discoordination between all of these cells. So, and a lot of times you can have both of these things going on. So if cells have lost power and you've got disrupted communications in the body and nothing is synchronized, then the first result, the most obvious result, is going to be fatigue. So you've got to address both of those things. And that was again, a topic of a full webinar. So if you guys want to go deeper, that's a great place to get that information. So when we talk about communications, that is communications within the cell to make sure the cell is running properly, but it's also signaling of every different variety. Hormones, neurotransmitters, a huge variety of different kinds of messengers in the body. So if you disrupt communications, that affects immune system functions, which is really important. And some of the most high energy cells, your high energy cells in your body are your heart cells, of course, your muscle cells, and immune cells. Immune cells take a lot of energy. So if you're compromising these things, then you're affecting functions in the body and you're affecting the total energy in the body. So that's really important. Our mitochondria, we basically burn out our mitochondria through our lifetime. Every cell has 100 to 1,000 mitochondria, and we basically burn them out. So someone at age 20 is going to have a much higher mitochondrial capacity and reserve than somebody at age 80. But that person at age 20 may have factors that are disrupting that process. So when you look at things that are disrupting communications and mitochondrial functions in the body, it always comes back to those same things that I keep talking about over and over and over. It's the microbes, what I call the 5 elements, the microbes, diet, toxic environment, stress, and activity level. All of these things affect immune communications and they affect mitochondria. The microbes, intercellular microbes, all these microbes that we're talking about, Epstein-Barr, Mycoplasma, Borrelia, they're all intercellular. And they take over the machinery of the cell to do their own bidding. And as they do that, they inhibit mitochondria. I found a whole list or a whole series of research that define different ways that microbes affect mitochondria in the body, these intercellular microbes. Diet. You eat too much carbohydrate and you drive the energy systems in your body too hard, especially if you're not exercising. So you build up free radicals and you burn out your mitochondria really fast. Most toxins, all of the toxins that are being shed by cars out on the highway, all of those things inhibit communications and they inhibit mitochondrial function. Stress does the same thing as a bad diet. It drives the mitochondria too hard and it disrupts hormone systems in the body. And then if you're sedentary, it just compounds everything. So it gets back to those things. Changing your diet, living a clean environment, herbs to balance that total microbiome. This concept of microbiome, I think, is really, really interesting, that there's so much research coming out in the past couple of years that about our microbiome that I think is just fascinating. I think all of us have the idea that we've just got these microbes that are independently working in our system and they're just hanging out. It turns out that all of the microbes in our body are talking to one another. They're all producing messaging systems that is just as complex and even more prolific than our brain. They're all talking to each other, and having the correct balance of microbes with communications between the microbes and between our cells and the microbes, which does occur readily, really keeps your body. It's just a huge factor in health and wellness. So it's not just Borrelia, it's not just Mycoplasma, it's all of these microbes. Recent studies are showing that we have a microbiome in our brains. And if that gets out of balance, we end up with illnesses like multiple sclerosis and Alzheimer's. This is just in the past year, some research has come out that's showing that microbe connection with these things. So I can't help but think that all of these illnesses are related to microbiome imbalances. Again, not a microbe, but multiple microbes in the system. And I think these intercellular microbes that we've been talking about play a huge role, but I think it is much more than the dozen or so things that we're calling the co-infections with Lyme. I think we're going to find that the possibilities, the active microbes, are quite a bit more. So that's just, that's a little bit on fatigue. I think it's a really interesting topic. It ties some really interesting things together. So let me see what else that we've got there. Robin Erlin asked, did it take a while for herbs for pain to lessen? Yeah, I did have a lot of pain with my situation, and it does take a while. I mean, I tell everybody, when you look at the recovery process, if your goal is wellness, not just getting rid of symptoms, then there is a certain amount of patience and persistence. I lived with a lot of my symptoms. That was before CBD was available. Later, I found that CBD is really valuable for helping symptoms like pain, some fatigue, anxiety. And again, I've got a great webinar coming out next week about pain. Again, I've spent the past month researching this one webinar to put all the little pieces together and boil it down to what people can understand. But I can comfortably say that I understand exactly why pain happens in fibromyalgia and chronic Lyme and many other illnesses. So that's a really important aspect. But it does take a while. In my course, I was fairly severely affected. I had really bad heart involvement. My heart was skipping beats every second or third beats, and I lived with chronic chest pain. I had a cardiac cath that showed my vessels were clean. They really didn't have much to offer me. That was when I said, I've got to figure this out. And that's when I embraced herbal therapy and other things. I had a lot of muscle pain. One of the difficult things was figuring out what was caused by the microbes and what was caused by food sensitivities, because I had really bad leaky gut at the time too. So I was juggling, trying to figure out my diet, taking the herbs for the microbes. But I'll have to say that gradually all the symptoms did clear. In my case, I'll have to say it took longer than I think it is most people now, because I was still figuring it out. I was still figuring out which herbs to take, how to go about this thing, what was what. Whereas, there's a lot more guidance for people now. It's a quicker learning curve. So most of my symptoms took anywhere from 2 to 3 years to gradually resolve, and neurological symptoms and pain were some of the slowest. Again, fortunately now, I think CBD from cannabis is really, really exciting as an alternative to look at treating pain. So just really quickly for everybody that might be just joining us, I'm Dr. Bill Rawls. I am doing a 3-hour marathon Facebook Live, answering questions, trying to carry people just a little bit further in their recovery process. And this is something that we're going to be doing more intensely in the upcoming year. There will be more Facebook Lives. There will be more questions and answers, though I will be doing a lot of writing. There's so much new research that's coming together. We're going to shoot for at least one webinar every month in addition to regular Facebook Lives. Our goal is bringing as many people through this pathway of recovery as possible, because I think so much of it. Somebody asked me earlier, why am I not seeing patients? And it's because when you look at our system, the way the medical system is designed, it's hard to bring people where they need to go. In our medical system, it's designed for us to get basic symptoms and look for a diagnosis, which has become all important now because you can't get paid unless you put down the right diagnostic code, and pass out prescriptions. And that's about all that you have time for. Where I found when you look at chronic illness, it's a process. It's not something that you go to the doctor and here's your prescription and you take this medicine and you're going to get well. You're not. You might reduce your symptoms, but that's about as far as you're going to go. For people to get well, you have to embrace the process of recovery. You have to be motivated. You have to have some personal accountability. And when you move from the point of, okay, I've got to find the right person to help me, to I realize that I'm the person that is going to have to take this journey, and I have to find the resources so I can make the correct steps through my journey to get well, that's when things start to change. There are a lot of things that can help you along the way, but the process is something that the person has to do themselves. And it's really not an expensive process. It's not expensive to eat well. It's not expensive to change the way that you're approaching life, just the little things in a day. Herbal therapy is the least expensive of any therapies, and in my opinion, it is absolutely by far the most effective and the least toxic and has the lowest potential for harm. So it's really, really important to do these things. So let's see. Dasha Kai asked, would you talk about Lyme seizures and which co-infections travel to the brain, diagnosed at age 59 with possible epilepsy, and the MRI showed 2 areas affected by Lyme. So yeah, that's interesting topic. This is another topic that I'll be diving into next week, this connection between the microbes and in brain tissue. And I think getting back to the pain issue, talking a little bit about CBD. So this is a good topic to hit on. Yeah, there are microbes in the brain. But guess what? we're finding that everybody has microbes in their brain. There were 2 studies that came out this past year. One study was looking at autopsied brains of people who had had Alzheimer's. The other was looking at autopsied brains of people who had had multiple sclerosis. The big surprise in the finding was there wasn't a few microbes. There were hundreds of microbe species in the brain, and most of which were from the gut and the skin. So the message from that is that our brain has microbes in it. It's part of our brain. And again, it's not the microbes that are present, it's how those microbes are being affected by the immune system and which microbes are starting to flourish. So that was the interesting thing in the studies. Both of these studies, they looked at control brains of people who had died from something other than a neurological illness, and they found a full spectrum of microbes from the gut and the skin in those people too. The difference between the disease brains and the normal brains was the spectrum of microbes. There were more intercellular pathogens. There were more pro-inflammatory microbes. So it wasn't necessarily that those weren't present in the other brains, they just weren't prominent, which suggests that there are factors in the immune system that are affecting those microbes. So there's not much doubt. Mycoplasma, Borrelia, chlamydia, quite a number of microbes actually get in brain tissue. All of the herpes viruses, of which Epstein-Barr is one of them, is part of that complex of the brain. And if the immune system is not being properly affected, then properly balanced, and you're not balancing that microbiome of the brain, then you can have symptoms. So yes, there's no doubt that I think this spectrum of microbes and microbes flourishing in the brain is causing symptoms. How does it do that? It affects neurotransmitters. It causes inflammation. Again, we're going to go a little bit deeper in that in the webinar, because that's the pain connection. Most of the pain that you have with fibromyalgia, chronic Lyme, other similar illnesses is because the brain has become hypersensitized and to pain. So you have hyperalgesia. And what they feel is driving that is elevated neurotransmitters that are stimulating, glutamate, and other things that you would find associated with that fight or flight response, and then suppression of calming neurotransmitters like GABA. So the brain is basically agitated. It's inflamed and agitated. So an agitated, inflamed brain, if you get a focus of things, that could potentially cause seizure activity, or activity that the brain is just goes into a spasm, basically. One of the things that would be top of my list for that is CBD from cannabis, hemp. I think this is another area of really exciting research. Most of the research on cannabis has been suppressed for so long because of marijuana. It's only been in the past 10 years that scientists are really looking at the value of this. And what I'm excited about is CBD from hemp. This is a variety of cannabis that doesn't have very much THC, the ingredient in marijuana that causes causes euphoria. So CBD is really has a totally different action. Now, all of these things, THC and CBD, are affecting a system in the body called the endocannabinoid system. It's a really important system that we're just finding out about because research on it was suppressed. In fact, it's probably the most important system in the whole body. And so what the endocannabinoid system does is basically oversees or modulates everything else. So it's modulating all the neurotransmitters in the brain. It's modulating the immune system. It's modulating all of our pain mechanisms. So one of the most prominent endocannabinoids in the body is one called anandamide. So we all have anandamide, and if you have normal levels of anandamide, you feel good. You've got a rosy disposition. You don't have pain. Everything is nice. So what we're doing with CBD and THC is we're affecting anandamide receptors, especially in the brain. But they do two very different things, all right? So THC binds to anandamide receptors in the brain very, very tightly. So you have an exaggerated good feeling, or you get high, you get euphoric. And the problem with that is it also suppresses natural anandamide, and it suppresses these endocannabinoid receptors in the body. So you need more and more and more THC to get the same effect. CBD from hemp has a very different effect. It doesn't bind to those receptors as tightly, so you get a little bit of a effect. It makes you feel like you have normal levels of anandamide, but you don't get a euphoric response. It doesn't make you high. It doesn't have any potential to make you high, which is really pretty cool. But it also has the effect of boosting your natural levels of anandamide and boosting your endocannabinoid receptors. So that way, when you look at seizure activity, the agitation of the brain, CBD is calming the brain. It's calming this. So it's one of the best things out there for childhood seizures. Really wonderful. But it's doing other things. It's increasing endorphins, which are our natural pain relief mechanisms. And it's also reducing that agitation from the aggravated fight or flight response, which is really cool. So so CBD looks really exciting. Again, we're going to talk about that next week. I think, a lot of people are saying that medical marijuana with a little THC is more potent, and there's no doubt about it. But as far as long-term use, I think CBD is definitely something we're going to look at. So let's see. Jamie Smith asked, do you agree with antibiotic therapy after 1 year? That's a trick question. That's a hard question. I have a tough time dealing with antibiotic therapy in general. The problem with antibiotic therapy is the type of microbes that you're getting. All right. So if you have an acute pneumonia and you've got extracellular microbes that are consolidated in one place of the same species, that's what antibiotics are designed for. I would never treat someone with an acute pneumonia with herbal therapy. It's just not going to have the potency. But when we're talking about these chronic illnesses with these intercellular microbes, I think that's really important. These microbes that have the ability to live inside cells, they're not consolidated in one place. They're distributed throughout the body. They're in the very recesses of the body. They're in protected areas like deep brain tissue. And so when you hit them with antibiotics, you hit your normal flora a lot harder. So you always are in a race when you use antibiotic therapy. Am I going to kill whatever microbe I'm targeting before I disrupt to my normal flora to the point that it's holding me back, that it's actually preventing my recovery? With a pneumonia, you're likely to win the race. With all these intercellular microbes that we're talking about, with what I consider to be chronic fatigue, fibromyalgia, chronic Lyme, I put them all in the same category. Probably different microbes with every person, but all with the same characteristics. I think you have less of a chance to win the race. And what I see with people that use antibiotics is, it helps. They get better as long as they stay on the antibiotic. But as soon as they go off the antibiotic, it comes back and stays. But the longer they stay on the antibiotics, they end up getting worse and worse. And I think that can be a huge problem. Me personally, I did not tolerate antibiotic therapy, and I used herbal therapy exclusively. I'm still taking herbal therapy. I still do antimicrobial herbs, not at the level that I once did. But I think this is just really important to keep your microbiome balanced. Like I said, people were getting these phytochemicals for hundreds of thousands of years on a daily basis. And I think if herbs are filling a void that is really missing in our diet. I've been taking herbs for over 10 years. I just don't have the joint pains. My energy is better. Life is good. And so I think they're really important. You just don't have the negative effects from long-term antibiotic therapy. Not to say that some people don't get well with antibiotics, and not to say there aren't some people out there that have certain microbes that need to be treated with antibiotics. But I would suggest that herbal therapy should be your foundation. You should be doing that primarily. And if you're trying a variety of herbs and other things and you're just not getting there, then you think about those heroic therapies, antibiotics, oxygen therapy. There are lots of things that you can do, but you got to mind that potential for toxicity. That's just really, really important. Let's see. Patty asks, can you briefly explain your herbal protocol? I think there are a lot of great herbs out there. And I think that you have to recognize that we've got a lot of history behind our herbs. So when I talk about antimicrobial herbs, I'm talking about herbs that have been found to have a stronger antimicrobial value. That's not to say that every herb doesn't have antimicrobial properties. I think that's really important. Every plant you see is being confronted with microbes and has to balance their own microbiome, and they do that with these phytochemicals. So all herbs have antimicrobial properties. Some herbs have stronger than others. It depends on where the plant evolved and what kind of threats it was having to deal with. So I have a lot of herbs on my list. There is a standard protocol that we generally use, and I call it just a basic foundation. I think it's a good starting point. About half of people will find that that's all they need, and they can keep going with that other long term. Many people there are going to want to add herbs, and I have through my lifetime. Over the past 10 years, I've taken a lot of different herbs. I enjoy experiencing different herbs. And I generally had a pretty good feel for what was working and what wasn't. But my basic starting protocol was a modification of what Stephen Booner wrote in his original book from 2005, Healing Lyme. And it includes Japanese knotweed, Andrographis, which I consider one of the stars of the formula, cat's claw from the Amazon, sarsaparilla, a stabilized form of garlic. The problem with garlic is if you chop garlic or cook garlic, all the active chemicals are killed. So there are processes where you can stabilize those chemicals so they're not affected by gastric juices. So that's a pretty good starting point for these kinds of intercellular microbes. I generally complement them with immune modulating herbs. And again, all the immune modulating herbs also have some antimicrobial and antibacterial properties or antiviral properties also. Reishi, cordyceps, Rehmannia is a really nice immune modulating herb. Red sage is another one. Chinese skullcap is a nice synergist. It helps a lot of the other herbs work better. And these all have some really nice viral properties. Chinese skullcap is a nice one for Mycoplasma. So that's a good starting point. But again, I think when you look at all these illnesses, we have so many different names for the fatigue illnesses because there's so many people that have different presentations. When you get right down to it, though, every person with any chronic illness is unique. Every person has a different chronic illness, and we may want to categorize people to help with our ideas of how we best treat them. But every person with any chronic illness has their own unique diagnosis. In other words, their spectrum of microbes, the way that the immune disruption came about, their genetics, all of the things about that person are unique, which make for an absolute unique disease. So that it's really important to start with a core. And if the core is working for you, I think that's fantastic. If it's not, add on to it. There's so many great herbs out there. Neem is a really nice herb. Cryptolepis that I mentioned for Babesia, Alcornia, Bidens, prickly ash. There are just so many. I have a book called Unlocking Lyme that I put a lot of those in the back of the book. So the core protocol is in there along with a lot of references to other kinds of herbs. So there's a nice list in there. But don't stop there. I encourage every person to learn about herbs, find out about these things. They're just really, really super important for us to know about. So herbs are really, really good. And it's and so if you make that your core and build out on that, there's a pretty good chance that you're going to start finding your way out of this misery. So let's see here. Oh, by the way, this is Dr. Bill Rawls. This is a 3-hour marathon Facebook. If you've just joined us, we're trying to tackle as many questions as we can about chronic illnesses such as chronic Lyme disease, fibromyalgia, chronic fatigue, trying to hit as many questions. Let's see. Luke Knudsen asked, what is your opinion on using infrared sauna for chronic Lyme disease? I think that's another one of those complementary restorative therapies that does a lot of good. We know that heating up the body is good as far as fighting off infections. That's physiologically, that's why our body develops fever. Microbes don't do as well when the temperature is raised. And that's led to some pretty extremes like hyperthermia therapy, where they put people under anesthesia and heat their body up to 107 for a couple of hours. That's kind of potent. I think there's as much potential for harm there as there actually is making headway. But we can do the same thing with sauna. Your body is heated up several degrees by infrared sauna. The difference in infrared sauna and regular sauna is regular sauna, you're basically building a dry fire and putting rocks in the fire that are moist, and so it's generating steam heat, so the atmosphere is heated. Where infrared sauna is radiated heat, it's focused on your body. It's basically coils that are heating up, so it's heating your body more directly. So it doesn't heat the air quite as much. It's not quite as stifling. And it's really nice because it's relatively inexpensive. You can buy a sauna for $1,000, and there are plenty of places that have them. You start with a fairly low temperature of 100 or to 110, and gradually work your way up to 30 minutes of 130 degrees. And basically, it just heats your body up for a couple of degrees and gets you sweating. So that has an effect on the microbes in particular. It helps balance out some of these potential pathogens and intercellular microbes in tissues. But it does other things too. It stimulates your immune system. It generates endorphins, just like exercise would. And it gets rid of toxins from your body. The type of sweating that you're doing infrared sauna is found to be one of the best ways that you can remove heavy metals and other organic toxins from your body. So regular infrared sauna just has some really nice nice accentuation of the healing process. I did it for a while. I had a sauna for about a year. And then as I was able to get back into life and start exercising, I tended to use it less and less. So basically, you're doing very similar things with exercise. If you get out and ride a bike for 10 miles, then you heat your body up a couple of degrees and you sweat and you get rid of toxins and you do all the same things. So infrared sauna is particularly good for people who just are ill to the point that they can't move very much. It's just so especially good for that. And I think it's worth the investment in those cases. But if you don't have the ability to get an infrared sauna, hot bath can do the same thing. And certainly regular exercise is excellent. So let's see what else we've got here. So Tim, can you help me with any questions?
Yeah.
Got anything going there? So let's see. Oh, more questions. Good. What are the best detox strategies, especially for people with MTHFR mutations? Oh, I'll try to tackle that one without going into a too difficult. This is from Jennifer Kelly, and yeah, I'll try to go into that not too deeply. MTHFR mutation. So what is that? It has to do with a process called methylation in our body. We need to methylate things in the body. That's one of the ways that we remove toxins. When toxins come into the body, they're generally fat soluble, and we methylate them to make them water soluble and to get them out of the body. So that's one of the steps in detoxification. Methylation is also important for turning off bad genes. If you don't have methyl donors in the body, then you can't turn off bad genes. So genes are turned on by bad health habits, and it's really important to move toward turning them off so that your body starts functioning better. So you want to have good methylators in the body. Fortunately, there are a lot of them, and there's concern that some people really don't have the ability to process certain dietary methyl groups to actually use them. And that is what an MTHFR mutation is. These individuals can't metabolize synthetic folic acid, and they have difficulty if they're on a high grain meat diet because they're not getting any folates. Actually, about half the population, 50% of people, have some kind of methylation mutation. And interestingly, there's not just one, there are many, many of them of various different degrees. When I was investigating this, I had to ask the upfront question of why 50% of the population had methylation defects. When you look at what we would call bad genes, the body abhors bad genes. We're always trying to shed bad genes. So why is it that half the population is carrying these supposed bad genes that are keeping them from methylating? Well, it turns out they're not really bad genes. They're just genes that weren't used very much in our past. If you look at diet, a healthy diet that's loaded with vegetables is loaded with methyl groups. You're getting all of the folates and all of the things that you need. And so for most of human history, our diet has been very, very loaded with the things that we've needed to methylate. So we haven't had to make methyl groups out of other things, such as amino acids from meat. So it hasn't been something that we've really needed historically. So what has happened, though, in the past several hundred years, and especially in the past 75 years, is we've shifted to a high grain, high bean, high meat diet. And those sources are very, very low in folates that are so important for methylation. So if you're not getting them in your diet, you rely on these backup pathways, of which 50% of the population doesn't have very good sources of anymore. So it's really very diet related. So mostly people who are eating a really high vegetable diet with a well-rounded diet, it's not really a problem. I actually have I'm one of the, I've got a single allele for one of the methylation defects. I used to check all my patients for it. And, as long as I eat well, I'm fine. I don't really have any problem. So it's very diet related. As far as treating it, there's certain vitamins you can take. Synthetic folic acid that's actually found in most multivitamins works against you because you can't metabolize it and it builds up in your system. So you need vitamins that are bioequivalent. They're bioavailable in the form that the body would use. So you need methyl ethyl tetrafolate instead of folic acid. And that's really important to look at in any supplements that you're getting. If you're getting normal levels of that and you're eating a high vegetable diet, you're going to be okay. You're going to be able to detox. You're going to be able to turn off your methyl groups. So that's really important. I've written several blogs about this. You can find on the Rawls MD website, and really tried to put this in perspective, that because my opinion is a little bit different than some of the functional medicine or integrative physicians out there, that people are getting told, oh, you're sick because you have this methylation mutation. And it's just not true. It's part of it. It's not the cause of it. So that's really important to put in perspective. Let's see, another question. Taking herbs on the long haul can cause gut discomfort. How do you deal with that? It depends on the type of gut discomfort. And I think it can affect your stomach. And the problem is the dry powders. Getting the herbs in us is difficult. If you were going to try to do fresh herbs in the quantity that we're using or trying to get those things in the quantities that humans were eating like 50 or 100,000 years ago, man, you would just be eating these piles of bitter roots and leaves, and it would be really hard to tolerate. But that's all that humans had to eat, so that's what they ate. So we try to get it into processed forms. You can do it as powders, you can do it as tinctures. What we're typically doing is a dry powdered extract. So everybody's mostly familiar with the water alcohol bottles of tinctures that you buy. Those are pretty good, and they tend to bother the stomach a little bit less, but the concentration is pretty low. So what we're using in our products is basically they take that bottle or they take the water alcohol extract, all the liquid, and they spray it on a surface and dry off all the liquid, so it becomes a very concentrated powder. So what you get in a capsule is like a half a bottle of one of those tinctures. So it's just a lot more of the phytochemicals from the plant. The downside of that is the dry powders can sometimes irritate the stomach. And that's true with a lot of things that have drying chemicals that we call tannins. That's a problem they have in Japan and China, is people have stomach problems because they drink 5 to 10 cups of green tea every day that has tannins that are very drying to stomach tissues, and that can be harmful. That's one of the effects that we see using these dry powders. One solution is I encourage people to take some kind of fat with it, because the fat protects the stomach. Coconut milk is ideal. The kind of coconut milk you find at the grocery store, flax milk, anything with a significant amount of fat. If you tolerate just regular milk or like lactose-free regular milk, that can sometimes help too. So taking it with the fat protects. That's why the British drink cream in their tea, because the tannins in the tea, if you drink just straight tea, will irritate your stomach. So you put a little cream in there, gives it a different flavor, but it naturally actually protects the stomach a little bit from the tannins in the tea. So doing coconut milk, if your stomach is really irritated, just taking a break from it. We have a product with something called slippery elm in it. Slippery elm and marshmallow from the original marshmallow plant have mucilages that are very protective of stomach tissues. So taking those kinds of products along with the supplements can help. Sometimes taking a break from them. So I think those are ways that you work around it. And that's one of the very, very few downsides I've found with taking herbal therapy is just the dry powders can get to you for a while. Sometimes in the past, I've taken a break from the powders and done tinctures. I found, though, that if I go off of everything for long term, I just don't feel quite as well. So I'm so much better if I'm taking some herbs. Again, I don't take the quantities that I did maybe 10 years ago when I was really in the throes of my recovery. But yeah, it really does seem to help make a difference. So let's see, 4 questions. Melissa Cromer, any ideas on how to treat tinnitus and anxiety along with your herbal protocol? I feel like my vagus nerve is being suffocated. Okay. Yeah, that's a pretty good question. So we're talking about sympathetic and parasympathetic nervous systems. Our life is a balance of neurotransmitters. Like I said, it's all about communication. It's how well the body is communicating. And when that communication is in balance, it's really important. So we have exciting neurotransmitters, we have calming neurotransmitters. So the exciting ones are called, as a whole, the sympathetic nervous system. So the sympathetic nervous system is taking care of all of our automatic things, our breathing, our heart rate, how our intestines work. It's also the part of the fight or flight response. All right. Parasympathetic is doing the opposite, and it comes through the vagal nerve, which goes down to your gut, and it's secreting hormones or neurotransmitters that oppose the sympathetic. So if you're balanced, your sympathetic and your parasympathetic are balanced, you're calm, you feel fine, and everything is working like it should in your body. But the state of chronic illness is affecting the parasympathetic nerve. It's hyperstimulating the parasympathetic nerve, the parasympathetic system, and suppressing it's exciting the parasympathetic system and suppressing the parasympathetic in the brain and all through the body. And that's a big part of, that's kind of a signature of these kinds of chronic illnesses. It's really interesting that in my research with this upcoming webinar about pain, the driving force behind the central pain that occurs in fibromyalgia is a hyperactivated sympathetic nervous system that takes away the controls of the pain response, so you get hyperalgesia. So it is driving a lot of these symptoms. It is what drives anxiety. And I'm finding that there's a huge connection to the microbes with this. Gut microbes, again, if you're eating the wrong foods and you cultivate a bad balance of bacteria, they're producing stimulating neurotransmitters and affecting the brain. There's a gut-brain connection that they're causing this hypersensitivity. In addition, the way the intercellular microbes affect the immune system and affect neurotransmitters is activating the sympathetic nervous system and driving symptoms of anxiety. Tinnitus is basically just ringing in the ears. It's an irritation of the nerves in the inner ear, and so that you get this just ringing that occurs all the time. It's a symptom. All of these things are symptoms. They're drugs that can treat tinnitus. They do so by blocking that response. They work fair at best, and they have a lot of side effects. So can an herbal protocol do these things? And I would say, you're going to get some symptom reduction with herbal therapy, but mainly, so there are really two components to the herbal therapy. One is treating symptoms, and the other is affecting the processes of disease. So by affecting processes, we're using herbs with strong antimicrobial properties and immune modulating properties to affect the processes, to affect the microbes, to balance the immune system. And that's ultimately going to get rid of the symptoms, but it's going to take time. So when you look at treating the symptom of this sympathetic hypersensitivity and parasympathetic symptom, it's things that are producing calming in the brain. So and having an overall calming effect. So there are a lot of herbs that are really nice for that. Ashwagandha is one of my favorite herbs for brain and balance. It affects the brain and does so, and as it does so, it's balancing stress hormones related to stress. It's balancing the adrenal hormones. It also has some antimicrobial properties. As I said, all the herbs do, but it's balancing the neurotransmitters in the brain, which have a positive effect. Other ones that do that are Bacopa is a really nice one, passion flower. Those are good. A favorite is L-theanine. L-theanine is a substance that you find in green tea. That's why green tea doesn't have quite the same caffeine effect. And what we think theanine is doing, really important, is blocking glutamate in the brain, which is one of the main exciting neurotransmitters that's causing this agitation. So you're blocking that with L-theanine, about 200 milligrams. I like to combine it with ashwagandha and other herbs. It really works very nicely. So those are some options for doing that. And then when you look at that whole effect again, you want to modulate the whole system. You want to affect the endorphins and the neurotransmitters, the balance of neurotransmitters, the brain agitation. You want to do all that together. So one of the best things you can do is affect the endocannabinoid system that I talked about a few minutes ago, ECB for short. And one of the best ways you can do that is with CBD oil. So I think for that effect, reducing anxiety, reducing pain, those kinds of things can really, really have a nice effect that can really help. And so not just the CBD, but combining it with other calming herbs, and then that foundation of affecting the microbes in the immune system to really get well will ultimately get you where you want to be. So from YouTube, can you come back from the last stage of Lyme? Well, yeah, that's a pretty simple one. Yes, it's. I definitely was there. I had every symptom of late-stage Lyme disease to a high degree, including all the neurological symptoms and cardiac involvement. My joints were shot. I was in pretty bad shape by the time I hit 50. I'm 61 now. I really don't have much in the way of, I don't have any arthritis pain. I have very little pain other than just overexertion with exercise. I can get out and ride my bike 10 or 12 miles without thinking about it. Don't have any cardiac symptoms. I may have some scarring there because I had pretty bad heart involvement with Lyme, and I don't think it's just Borrelia. I think Bartonella and other microbes are part of that whole thing. And they're finding, as they're looking in the heart and looking at autopsy specimens, they're not finding just a microbe in people with illness. They're finding a spectrum of microbes. I have to keep coming back to that. When you're talking about chronic illness, it's never, ever one microbe. It's a disruption of the microbiome with these microbes that are flourishing. So yeah, there's no doubt. You can come back. You can do some remarkable things with your life. Patience and persistence. It didn't happen overnight. I embraced herbal therapy. I can remember I had been kind of toying with a little bit of herb here, a little bit of herb there. I changed my diet. I was getting better, but I just wasn't getting where I wanted to. And I read Stephen Booner's book. This was 2005. And it was just after it came out, and it was like, yeah, I'm going to do this. My wife thought it was crazy. I had boxes of capsules, and I started taking just handfuls of capsules 2 or 3 times a day. And I started getting my life back, and it's I haven't looked back. There were a lot of ups and downs along the way. I've certainly had plenty of relapses, but I gradually got better in understanding why I was having a relapse and what to do about it. And so yes, absolutely. For folks who are just joining us or may have just joined us, I am Dr. Bill Rawls. I'm been a physician for 30 years. Half of that has been trying to help people with Lyme disease and chronic fatigue, fibromyalgia, these illnesses for which the medical system really doesn't have any great solutions. And so we're at it here I think we've got another hour or so to go. And so hitting as many questions as I can. Let's see. Lisa Higgins asked, is there anything besides healthy eating, CBD, and drugs for back and leg pain? Yeah, I think there are things out there. It's and my specialty is herbs. That's where I've focused a lot of my research. But I think there are other things too. When you look at fibromyalgia pain and look at the scientific literature of all the things that have been used for fibromyalgia pain, the thing that gets the very highest marks. Now, again, a lot of the scientific literature hasn't looked at a lot of the herbs that I'm looking at because they haven't really connected the microbiome and microbial aspect of fibromyalgia and chronic fatigue. But beyond the herbs, there are things out there, and the thing that's top of the list is Qigong. There were a whole series of studies done on fibromyalgia that showed extraordinary results with every person that did it. A similar group of studies were done for yoga. So Qigong, folks that don't know what that is, it's an ancient Chinese art of movement. You would probably know Tai Chi. Tai Chi is a form of Qigong that's actually very complicated. Qigong is easy. Qigong is just repetitive movements, gentle movements, and it stimulates endorphins, and it gets the people's energy balanced again. When you balance your energy, you balance those communications in your body. So Qigong is something that's really, really valuable, that has a lot of benefit. Yoga is right up there with it. I think you have to be careful with yoga and not to overdo it, because you can actually set yourself back. So it's gentle yoga and Qigong. And these are things that can help pain, can help recovery, that are really important. Now, beyond that, those are things that you can do yourself. Anybody, everybody can do that, should do that. There are other things that people are looking at, and probably one of the top of the list that I would say is cold laser. This is something that the chiropractors are using. Conventional doctors, you occasionally see it in orthopedic offices. What it is thought to do is inject energy into the body that is stimulating mitochondria and stimulating healing. So cold laser is opposed to hot laser. Hot laser is laser that burns. Like if you use a CO2 laser, it burns your skin. Whereas cold laser is not, it doesn't burn the skin. You get a feeling of warmth with it, but it can be applied to lower back, it can be applied to joints, and it does stimulate healing. There's even some experimental work being done using it on the brain with improvement in certain kinds of neurological symptoms. So I think that's an interesting area that people are really looking at. Other ways of putting energy into the body, low amplitude electrical currents can be valuable. So hyperbaric oxygen, this is a place where if you're already on the herbs, you've already changed your diet, you're doing CBD, you're doing these other things, hyperbaric oxygen or even ozone can get you there a little bit quicker, can reduce some of these symptoms. So that's where I think, if you're doing all of that foundation that's so important and you're not quite getting there, or you're still having symptoms, then looking outside the box and considering, what is the best thing for my money? Should I try cold laser? Would be a thing to consider. Hyperbaric oxygen might be a thing to consider that could reduce pain. But again, it's going to be more transient. So you want to be getting well, because ultimately what's going to reduce the pain and reduce the symptoms is suppressing the microbes, getting the immune system back to be the way it should be. So let's see. Connor Curl asked, is THC an important synergist for CBD to be more effective? That's a big question out there. When we look at cannabis, cannabis in general. I'm talking about cannabis a lot because there's a lot being said about cannabis right now. It's a hot topic, and so the difference between marijuana and hemp has just to do with an enzyme in the plant that converts a system called cannabigerol to either THC or CBD. So it's actually the same species of plant. It's all Cannabis sativa. All right. But you have a range of differences. So at one extreme end, you've got a plant that's producing almost exclusive THC, and the other end, you've got hemp that's producing almost pure CBD, and then everything in between. So certain in Colorado and California, places where it's legal, they're experimenting with this full range. And the THC is more intoxicating. And so you're going to find that more in recreational users. So the more you go down to this end, the more medicinal, because you really don't want to walk around in a stupor your whole life. So there's a lot of question about which is the best medicinal, pure CBD or a variety of hemp with CBD plus a little bit of THC. And That is an unanswered question. Most people are reporting that if there's some THC there, they get more symptomatic benefit. And I think for short term, that's probably okay. Long term, though, I think CBD is going to be your better bet as far as a long-term medicinal for promoting healing and helping out with these symptoms long term. Why? The reason that that's the case is because of the effects that THC and CBD have on the endocannabinoid system in the body. So THC suppresses your natural anandamide. That's the abbreviation, and it also suppresses endocannabinoid receptors in the body. Any amount of THC will do that. So if you're using it long term, you're actually hurting your endocannabinoid system to an extreme degree that it's been found that people that are habituated to THC, THC is habituating, CBD is not, but long-term marijuana users actually have atrophy in certain parts of the frontal areas of their brain. So they've got brain atrophy from using it long-term. The unanswered question is, will using small amounts of THC lead to habituation, which I think is possible, and potentially cause this problem long-term? We don't know yet. But it is interesting that CBD has the effect of actually increasing natural anandamides. And it appears the more you use it, the better that effect gets, and increasing the receptors, which is really good. And even more interesting, I found a study where they took a group of long-term marijuana users who had brain atrophy. They switched them to CBD long-term, and their brain atrophy resolved completely. So that's a big vote for CBD being your main therapy long term, even at the point that marijuana becomes illegal or becomes legal to use medicinally. I still think long term you're probably going to get your best benefit from the CBD. So it's just a little bit on that. I have researched the topic extremely heavily for many, many years. So it's there's a lot of really good, interesting research out there, and I've tried to very recently. I've been really digging into all the literature to see what we do know and what we don't know. For those folks who might be just joining us, we're on a marathon live question and answer session. I'm Dr. Bill Rawls. We're going to hang in there for another hour. Still got lots of questions to come. We're going to hit as many as we can. Again, lots of information on my website, Rawls MD. I've got a book out there, Unlocking Lyme, that even if you have fibromyalgia and chronic fatigue, you can learn a lot about the illness in general, because I really see those things as being one and the same. But thanks, everyone, for joining us. Michelle Whitek asked, please speak to women over the age of 50 regarding EBD, Lyme infections, brain fog, and hormones, hot flashes, and waking up at 2 a.m., migraines, light sensitivity. Yeah, that was my first career. I was a gynecologist, primarily OBGYN for 20 years. And I, early in my career, this has been, almost 30 years ago when I started my career, I early on adopted bioidentical hormone therapy and started using herbs in my practice. So I was a little bit of a renegade even then, that I was a little concerned about some of the pharmaceuticals on the market for estrogen replacement therapy. I've certainly never experienced menopause, but I have helped enough people with menopause that I can certainly empathize, and I feel like I understand menopause. Technically, it is not a disease process, but that point in life, it's all about communication. How we feel is about communication in our body. And when ovaries stop working, it throws the hypothalamic pituitary adrenal axis, our simple hormone pathways that govern everything in our body, it throws them into an absolute tailspin. So if you happen to be struggling with a chronic illness, at the same time you're going through menopause, it can be devastating. And so it's certainly much worse. So menopause itself can be bad in general, but it is certainly compounded, and the two compound each other. So what do you do about it, and how do you approach it? I think building that foundation is really important. I found that through my practice that women who had really good health habits and good diet had much less severe menopausal. That transition was much less rocky than people who had poor health habits. So I think you've got to establish that foundation. Options for things. What you're trying to do is balance the hypothalamic pituitary adrenal axis. This is really important. So you've got your brain and you've got your thalamus, which is kind of the relay station, and just under that you've got the hypothalamus. And the hypothalamus governs all the automatic things in your body, temperature, sleep, all of these things that happen automatically that function are happening there. And it does so by affecting the thyroid gland, the adrenal glands, which are on top of the kidneys, and the ovaries or testes. So the hypothalamus goes through the pituitary gland to affect the thyroid gland, the adrenal glands, and the testes. And these glands are constantly giving the hypothalamus feedback of how things are going. Communication, there has to be constant communication. When you interrupt that feedback coming from the ovaries, often very abruptly, when the ovaries run out of eggs, it affects everything in the body. And then if you've got a disease process going on, then it's even worse. So basically what you're trying to do is balance the hypothalamus to restore the comfort. And there are different ways that you can do that. Herbal therapies that are really good. Top of my list, I mentioned before, ashwagandha is a wonderful herb for balancing that hypothalamus. So ashwagandha is good for reducing hot flashes and restoring benefit. Combine it with L-theanine and a few other herbs. That was the first product I ever made, was ashwagandha, L-theanine, and 2 calming herbs. And that it just did extraordinary things for hot flashes. It was really, really awesome. So ashwagandha and other herbs. If you're still going through menopause, going through the cycle, there's an herb called Vitex that can help balance that. Affecting the feedback. Natural progesterone cream is a really nice way to do that. That can really do it. And then, ultimately though, if none of those things are working and you don't have concerns of family history of breast cancer and that sort of thing, estrogen, affecting this feedback pathway can really help the process. And what I found in my practice is using hormones that are easy for the body to metabolize. Premarin, the most common product on the market, is 25% 25% of the hormones in Premarin don't have a look-alike in the human body, and they just hang around. They're not metabolized. It's from horses. It's very, very potent. It will take care of hot flashes, but there's no doubt that it can increase breast cancer. So you're looking for that balance. Most of my practice, I used a product that was called Biest. It was estradiol, the natural hormone in the body that the ovaries produce, and a weaker hormone called estriol. It was predominantly estriol. There are different combinations, and balance that with progesterone. The estriol is a very weak estrogen and actually blocks estrogen receptors in the breast so that it doesn't cause over-aggravation of, it doesn't excessively stimulate breast tissue. It competitively inhibits the estradiol and natural estrone in the body so you don't get overstimulation. And there were some studies in Europe and Japan that supported this, but it was the company that makes Premarin, named YF, really went after this whole thing and made it very difficult to get these products. But you can still get them at compound and pharmacies. So if you make the choice of going with estrogen replacement therapy, I would strongly recommend finding somebody who really understands bioidentical hormone therapy and complement that with herbs so that the amount of estrogen you have to use is very small. I typically, with combinations of herbs, was able to get the doses down to very small doses of transdermal preparations. And I feel very strongly that the way that I went about managing menopause, I did not increase risk of breast cancer in women. So let's see here, just where we are again. This is Dr. Bill Rawls. I am doing a marathon Facebook Live question and answer. So we're answering questions about anything from chronic illness to now menopause. And so I'm game for most anything. A lot of questions. I've got folks here helping me just figure out what are the most pertinent ones. And Deb Pacheco, yeah. What can I do for a stomach ulcer and possible colitis? I'm afraid herbs will exacerbate the pain and cramping. Yeah, I addressed this a little bit earlier. There is, the herbs can, the dry powders can do that. So stomach ulcer, sometimes for a full-blown stomach ulcer, you do have to end up treating it with the drugs that reduce stomach acid, but I would suggest doing that for only short periods of time at the most. The problem with those drugs is they stop digestion, and people end up on them chronically, and you just chronically don't have good digestion. So it's not a good process to use. It's not a good thing to pick up and use long term. You got to protect the stomach. It's there's no doubt that there's some really nice herbs for doing that. I mentioned earlier slippery elm and marshmallow. Those are very good. Mastic gum. I mean, there are a long list of herbs that protect the stomach. Eating well, chewing your food really well, eating foods that are easy on the stomach. Doing things that make it easier for your system to digest food. Cooking your food well. You know, people that have really bad digestive function, I suggest not eating raw foods like salads and that sort of thing. I really think you should cook your food and make it easier for your digestive tract. So protecting the stomach, protecting it from acid, using an acid reducer short-term temporarily until you get healing, and then long-term use the protective agents like slippery elm. Balancing the bacteria in the gut. You know, there's a strong tie between H. pylori and stomach ulcers. A lot of gastroenterologists will say, well, you've got a stomach ulcer because you've got H. pylori. That isn't the case. H. pylori is a secondary infection. In other words, there are things that happen that erode the stomach. Stress is huge. Stress is huge, and a lot of people don't realize how much stress they're really under. Processed food diets, all of these things add up to erode the stomach. And once you have that erosion there, you get a secondary infection with bacteria like H. pylori. So addressing the H. pylori is an issue, but there are a lot of things that will do that. And some of the herbs like berberine, I think, can be superior to using antibiotics, which can disrupt the whole gut. Same thing with colitis. It's what you eat and the herbs. For colitis, I've found nothing better than the herbs. Some of the herbs that I mentioned already. There was a well-done study using andrographis in comparison to several of the drugs out there, and andrographis did a better job, or it did as good a job with ulcerative colitis as any of the drugs, but without the side effects. So when you couple a really good diet, and it's a little bit too much to go into the details of that in this short while, but we do have a nice diet guide and a good diet program. Then that's when you couple a really good diet program and together with the herbal therapy, with the protective therapy, with things to enhance motility in the gut, digestive bitters, you can get some really extraordinary effects. I've had quite a number of people with ulcerative colitis respond to that therapy extremely favorably, and actually get well, so they didn't have to stay on the drugs for a lifetime. So sometimes, though, the herbs don't treat the symptoms, and short-term treating symptoms with drug therapy or other things over the counter is important. But the long-term, it's the healing therapies that are going to get you where you want to be, getting back to that place of wellness, which is possible. I mean, I know about so many things because I experienced so many things. I have really, really bad gut function in the middle of all this, as most people do. I mean, my gut was terrible. I did a food sensitivity test, and 75% of the things that I was eating, I was allergic to. So I had, it's pretty severe leaky gut. So it's, but you can get it back. My gut function now is normal. Most of the leaky gut is healed. I still have a few sensitivities. I can't eat nuts readily as much as I would like, but most things I can eat well now, and certainly I'm feeling better. So to mention also, a lot of this information is in my book, Unlocking Lyme. As just part of this holiday season, we're doing a book giveaway. All you got to do is pay shipping and handling. That will be, we've had that on, and it will be going on through tomorrow. So if you'd like a copy of my book, Unlocking Lyme, all you have to do is contact us, and you'll get it free just for the shipping and handling. And it's just a normal shipping and handling fee. It's actually how much it cost us, not an inflated fee. So you really are getting a good deal on that one. And it's just, I have all of this information that I've learned. If I hadn't had this, I would be just practicing OBGYN and aging out of a career that I would probably be getting really bored with. And this thing that happened in my life totally changed. I had no idea that I would be in this place, but it has propelled me to accumulate as much knowledge as I possibly can to help as many people as I possibly can. So it's really important for me to get that out as many different ways as I possibly can. There'll be more books coming, lots more webinars, plenty of Facebook Lives. I would like to, in the next year, connect with as many people as I possibly can. So if you're interested, I think it's, what was that website again, Tim? unlockinglyme.com. Yeah, if you go to unlockinglyme.com, you can get a free copy of the book. So more questions while I still have some voice left. It's starting to wane a little bit here, but Joe asked, at what point would you suggest hero treatments, and would you use herbal therapy with that heroic treatment as a following sustaining therapy? Yes, absolutely. I mean, I see it as a foundation. Again, if you've just joined us, I look at therapy as this. I think everything is important, but you got to put it in perspective. So restorative, I put here symptomatic as far as priority, and then heroic therapies up here. And I think it's important to build your foundation, and your foundation is good diet, herbal therapies, infrared sauna, all the things that have a low potential for harm and a high potential for enhancing the healing process. But in the short term, symptoms of sleep, symptoms of pain, those kinds of symptoms are really pronounced. So sometimes just up front, you've got to address the symptoms. And then that thing that I call heroic therapy, antibiotics, drugs, surgeries, those things work best for acute symptoms and acute conditions like a broken leg or a heart attack. So I think building that restorative base is important, dealing with the symptoms in the least toxic way you can. It's like, we're finding that CBD might be a partial solution to the opioid epidemic, because, the problem with opioids like narcotics is they suppress your endorphins in your body, so you actually become more pain sensitive. Same thing happens with drugs like benzodiazepines for anxiety. You suppress your normal GABA and actually make your system and your situation in the long term worse. So these heroic therapies always have a price to pay, and you've got to be careful with them. That being said, I don't exclude them. I think they're part of the equation. So the first thing I tell people is work really hard to build your restorative base. In the meantime, take the least toxic thing for symptoms. In other words, if you have access to medical marijuana or CBD, try that first. And if that isn't getting it, maybe a small dose of a opioid like Ultram, Tramadol, or non-steroidal anti-inflammatories might be a reasonable thing, but try to keep the dose as low as you can. If you're doing all of this stuff and you're not getting there like you want to be, or you're not getting there fast enough, that's the case where you might want to consider, well, do I have something? Do I need further testing that I may have a microbe that I just need antibiotics? I think that's going to be few and far between, but there are going to be people that need antibiotics. There are going to be people that are doing all this, and they still need that. They still need other things just to boost it. But you got to be careful, and you've got to think about these things more intermittently. What I see all the time, people, is what I see all the time though is people that are using heroic therapies exclusively. And what they do is they bounce from one thing to the next, and they get a little better for a while, and then they crash, and then they're on to something else, and it's the next best thing. And the next thing they know, they've spent 60 or 100,000 over several years chasing these heroic therapies. So these things are going to be much more cost effective for you. And certainly, anytime you're doing these things, certainly do all of the other things. They're so remarkably important. So it's so that's just really, really important to keep in mind. Really, really important. So yeah, Next question, Marlene. From Marlene, what is causing lymphatic leg symptoms, and will swelling go away with treatment? Well, there are a lot of things that basically cause lymphatic leg swelling, and this can be one of them. I mean, we've got a human here, right? And so we've got our vascular system from our heart, and it's pumping blood throughout our system. It pumps blood into arteries, and that goes all the way down to capillaries, and the capillaries through the capillary system, which are the smallest vessels, and back up through the venous system to the heart. So the capillaries are leaky, right? So you've got, those are the very smallest vessels. They're very thin, and they're leaky on purpose so white blood cells can go out into the extracellular system, so nutrients, so things can pass through, but also liquid passes out into that system too. And so we have leaky vessels throughout our body, and the vessels leak, and that fluid has to go somewhere. So it'll eventually build up pressure, and it collects in our system called our lymph system. And our lymph system collects all of this fluid and dumps it back into the vena cava at the heart. So we recirculate all this fluid. And so white blood cells are going in and out of the vascular system into the extracellular space, and they collect debris, microbes, etc. So the part of the lymph system is lymph nodes, okay? So one of the things that's happening in any kind of bacterial infection or cancer or anything is you have white blood cells that are collecting all the debris, and they're making their way through the lymph system to lymph nodes. You have lymph nodes in your groin, back of your leg, up in your neck. You've got collections of lymph nodes throughout your body, and lymph nodes are the processing center, so that they picked up all the debris, or debris has been tagged with antibodies for removal in lymph nodes. So all of that comes to the lymph nodes. So if the lymph nodes are overwhelmed, they basically get stuck. They get all clogged up. And when they get clogged up, you get fluid backed up into the lymph system and the extracellular space. So basically, if you've got swelling, lymphatic swelling, it's just that your lymph nodes are clogged up. So there are a lot of things that you can do for that. It depends on the cause. If it's more associated with Lyme disease, then it's more general. If it is associated with something like cancer, then it may be specific to wherever that lesion is located. So people with breast cancer often have swelling of an arm. So one thing to do is physically remove it. There are massage therapists that actually specialize in milking that fluid back out. So they help with that. So massage therapy can be helpful. Just long-term therapy with herbs gradually clear up the system. Better diet, exercise, losing weight, infrared sauna, all of those things help with clearing the lymph system. There is an herb, there are actually many herbs, but there's an herb called red root that is very good for clearing the lymph system, of flushing the lymph system. You usually don't use that herb long term, you use it as a tincture short term for a couple of weeks. So sometimes it's all of the above to really clear things out completely. But that's the lymph system. So we've covered a lot of systems so far today. All right, get some drink here. Very good. All right, so moving on. Once again, this is Dr. Bill Rawls. This is, we're doing a marathon Facebook Live question and answer, answering as many questions as we can over a 3-hour period. And we've got about 35 minutes to go. So we'll try to hit as many questions for anybody that's still hanging on here. So Valerie asked, do the herbs in your protocol for immune support include something for mycoplasma? Yeah, I think, the really cool thing about herbs is you're talking about a whole spectrum of chemicals. You're not talking about a chemical. The herbs have hundreds, and that really is one of the features that separates them from antibiotics. So when you ask that question, well, does this herb cover for mycoplasma? What you're really asking is, has anybody looked to see whether this herb covers mycoplasma? So there are a lot of things out there that cover different microbes that nobody has really taken the time to look for. But there, as far as herbs that people have looked to see if they're effective for mycoplasma, one in our formulas that stands out is Chinese skullcap is really good. But we feel like some of the other herbs, ashwagandha that we commonly use for resetting the hypothalamus, has some activity. And a lot of the other herbs are going to have some mycoplasma activity. All of it is going to be suppressive. The only thing that can truly take care of these things is your immune system. So when we look at herbal therapy or even antibiotic therapy, we're talking about how do we assist the immune system in doing its job? Can we suppress these microbes enough that it can get back to where it needs to be? Other herbs outside of our protocol, Houtonia is pretty good. Let's see if I can spell that one correctly. Houtonia. That's another good herb. Another one that I like is that I think probably is one of the best antimicrobial herbs is from the Amazon called Anamu. Anamu is an excellent microbial herb. I don't put it in our formulas though because it will make your urine and feces have a really, really strong smell. But it works great. It's a really, really nice herb. Really, really nice herb. So there are lots of herbs out there. But that certainly doesn't say that the other herbs in the formulas probably don't add coverage also. Let's see. Patricia Quintana asked, is it advisable to start on supplements for sorting the body such as carnitine and glutamine before doing the herbal protocol, or would that overburden the system? The question is it necessary? Quite frankly, there's a lot of focus of integrative physicians, functional medicine physicians, on using what I call bioidentical compounds, vitamin-like compounds to tweak things in the body. So, you measure all of these things and you look what's deficient and you load the body with those things. And it works in a few cases, but quite frankly, across the board, there's not that much evidence for a lot of things. And it's, when you look at amino acids, a lot of our neurotransmitters, a lot of the things that make our mitochondria work are from amino acids. So glutamine is actually the most prevalent amino acid in our food. You get tons of glutamine, and you do different things with it. One of the main things you do with it in your brain is you make glutamate, and bacteria in the gut also make glutamate, which is your most exciting neurotransmitter by far, 100%. So, the question is, does taking lots and lots of glutamine in your diet actually make a difference? There's some suggestions that glutamine actually helps gut recovery. I haven't really found that to be helpful in my practice. I think the herbs, hands down, are 10 times better than glutamine. I used it myself. I got nothing from it. I used it in my practice. I got nothing from it. It was really the herbs that mattered. So that one, I just don't really think you need to do tons of glutamine. I just don't think it's helpful. That's an opinion. there are a lot of integrative and functional medicine doctors that would disagree with me strongly. Carnitine, I just really heavily researched mitochondria, and I looked at all the evidence surrounding carnitine. Why is carnitine important? The main thing that carnitine does is it pulls fatty acids into your mitochondria. And that's why it's important. And it's really important. It's so important that we can't live without it. But it's also so important that your body can readily make it, and readily does make it, out of a lot of different things. So you make lots. You can make all the carnitine that you need. And there really isn't a whole lot of evidence. There's some limited evidence that acetyl L-carnitine can increase brain function, but it's pretty darn limited. As far as really helping mitochondria, I didn't find that there's very strong evidence. It was pretty weak. Not that being said, taking L-carnitine isn't going to hurt you, but I don't think you're getting very much benefit. If you want to help your mitochondria, coenzyme Q10 is the most important ingredient, because that your body does have a hard time. It saves your body steps. But carnitine, as far as supplements to spend money on, there are other things that I would probably do before carnitine. For most things like this, I think the herbs are superior. And even coenzyme Q10, you need 200 to 400 a day before you're going to do really much of anything with it. So it's so let's moving on. Let's see. Christy Caldwell asks, can you touch on Herx reactions and how to lessen them while healing? Yeah, basically a Herx reaction is we talk about it as bacterial die-off, that you take an antibiotic or you take an herb and it kills the bacteria, and pieces of the bacteria clog up the lymph system, cause a lot of inflammation, and make us uncomfortable. I actually think it's a lot more to it than that, because there are only certain bacteria that break apart and cause Herxheimer reactions. I think what's happening is we are in effect intensifying the war that's going on inside. You know, I see illnesses like chronic Lyme and those associated with these intercellular microbes as being basically a war between the immune system and the microbes in the body. The whole disruption of the microbiome. Again, it's not one microbe, it's a spectrum of pathogens who are flourishing, and the immune system is just can't get a handle on it. It's this pot boiling over. So you've got this intense immune reaction. And I think when you throw herbs or antibiotics or anything into that process, you intensify that war. And so you intensify the immune reaction, and you intensify the side effects and discomfort with that. And that's what I think of basically a Herxheimer is. So one thing you can do is bring down the intensity. So you reduce the therapy that may be driving it. The herbs, the antibiotics, whatever is driving that antimicrobial therapy. One thing you can do is, another thing you can do is reduce the inflammation using anti-inflammatory herbs like turmeric and boswellia, fish oil. You know, there are other things that you can do to reduce the inflammation. Moving blood in your body, far infrared sauna can actually gradually reduce the Herxheimer reactions. And as far as just treating the symptom and overseeing that immune reaction, I think CBD from hemp could actually have some pretty good benefits. I think we're going to see that as a primary therapy for that. You know, I seem to be mentioning CBD a lot. I don't consider it a cure-all. I don't think it has the same antimicrobial properties as other herbs, but it is a nice immune modulator, and I think it's nice for symptoms. So I do consider it, along with other herbs, as being very important. So let's see, from Evie. I used to be able to have a few drinks with no issues. Now I can. As soon as I have some, I get a headache. And is this issue related to sensitivity, as you mentioned earlier? Should I get it tested? No, it's I think it's multifactorial. It's part of it is the alcohol. I have the same thing, and I'm still sensitive. I have to be careful how much I drink. But for a long time, boy, just a half a glass of wine, a beer, I would feel absolutely horrible. So I think there are several things going on here. Part of it is the alcohol. Alcohol itself is a toxin, and when our body's communications, I keep coming back to this, when communications are disrupted, things don't work as well. So if communications in the body is disrupted, you affect your detoxification systems. Your detoxification systems are not working as efficiently. And if your detoxifications aren't working efficiently, you're not breaking down the alcohol. It's affecting your cells differently. It's more of a toxin. And once you start breaking it down, the metabolites are actually exciting to your system. But it goes beyond that too. And it has to do with substances called amines. All right. Amines are chemicals in nature. They're also neurotransmitters that we make from amino acids. The main one in the body that you might recognize is histamine, right? Histamine is a very important messenger. It has to do with allergic reactions of fighting off different kinds of worms. And it also is important for producing stomach acid in the body. It is very exciting. It's a primary exciting neurotransmitter in the brain, as are any amines. And there is evidence now that they can cross into the brain. Now, bacteria make a lot of amines, right? Bacteria that ferment things make amines. So if you're getting an alcoholic product, unless you're drinking pure alcohol, you're getting other components of the fermentation process. So bacteria that ferment to make beer, alcohol, and other spirits are producing amines. It's very prevalent in beer. Other spirits, you can find it. Wines, it is highly variable. Some wines, red wine is much more apt to, and red wine that's been aged in an oak barrel is more apt to have amines in it. But there are a lot of different amines, including histamine, that these bacteria produce. And so when you drink the alcohol, you're actually not only getting the alcohol effect, you're potentially getting amine effects. So that can really affect that whole alcohol process. Beyond alcohol, though, this is one of the things that we see in just gut dysfunction and leaky gut. There are a lot of bacteria in the gut that produce amines too. So if you're feeding your gut lots of things that they can ferment, you're generating amines in your gut, and you're affecting that gut-brain balance so that you're driving that agitation and hypersensitivity in the brain. So what you eat, what you drink is really, really super important. So let's see here. All right, any other questions for me there, Tim? So I'm relying on you now because there's just so many. So, all righty.
from Senyesco. Is it important to test liver CYP SIPs before taking supplements like berberine or antifungal meds? There are some suggestions that finding out about these small segments of active DNA in our system can help us determine which things we're going to react to and which things we're not. This is not an area that I have a strong expertise. I'll admit that right up front. But I will say that, people have been taking these things for thousands upon thousands of years, and they're mostly well tolerated. So I think things like berberine are going to cause less overall problems than some of your drugs. I don't know that we are that good yet to be able to really define what one person should take and what one person shouldn't take. I recognize that I probably have some pretty significant things in my system. I seem to be quite sensitive to a lot of drugs, and I have an opposite reaction, or most drugs I have odd side effects. So I certainly have some things in my genetics, and I have to be careful with certain supplements too. But how much value there is to actually testing, it really depends on the cost. I mean, all information is good. It's just you've got to define how much you're willing to pay for that information. So one thing that I used to teach medical students is, before you order a test, define how much the value of that test is going to change your management. And what I see in medicine all the time, and how people pursue things, is we do a lot of testing for information that we never use. I would say at least 75% of the labs that are drawn in America, and 75% of that huge expenditure, are for labs that nobody's going to ever use that information. Most of the time it's just stuffed in a drawer or in a computer file, and it doesn't make any difference because we love ordering tests. So I think it's very important to ask, how you're going to use that information. And for most things like natural supplements, especially, I think just trial and error is really important. I mean, I've certainly over through my lifetime find things that I don't do well with. Valerian is a typical example. Valerian is an herb that's commonly used for sleep. It has strong effects. It affects the GABA system. I take it, it agitates me. It keeps me up all night long. I know that's a genetic quirk in my system, but I just learned pretty quickly. But the herbs are very forgiving. I mean, it's you try it one time, you realize you don't have a good effect, and you just don't do it anymore. That's true to a certain extent with the drugs, but I think there's more potential for harm. So sometimes it's just trial and error is a reasonable approach depending on the price and toxicity you pay. In other words, if the potential of trying something, potential of toxicity or the cost is low, then it is something to be considered. So let's see here. April asked, is the IGeneX test still the most accurate? And IGeneX is a company that they do a lot of testing now, but they grew their market doing a version of the Western blot. The Western blot is the test the primary test that we use for testing for Lyme disease, and it is using serology. All right, it's using antibodies. When a bacteria invades your body, you make antibodies to that bacteria, and antibodies are basically just little tags that stick to the bacteria or particle or whatever. And it basically just said it's a signal for removing. So a white blood cell can come along and recognize that antibody tag and go, we got to get rid of this. And it consumes it and takes it to a lymph node and gets rid of it. So when we get bacteria or any other foreign objects, we produce antibodies to them. You can measure the antibodies and you indirectly ascertain the presence of a bacteria. The problem is we've got 20,000 plus different microbe species floating around in our body at any given time. And there's a lot of cross-reactivity. Most of us have a species of Borrelia that lives in our mouths. That's a normal flora. And there are a lot of other relatives of Borrelia that are part of our microbiome. So there's a lot of cross-reactivity in the testing. So you don't just test for this one antibody, you test for a variety of different antibodies to cut down on all that cross-reactivity, and you get the best match you can. So for the Western blot, we're checking antibodies that are called IgM, which is an acute infection, and IgG, which is for a chronic infection. And pardon me, I think and how they test for this is they use a process where they run the serum through a sorter that puts it down on a band. So when you have a positive band, it's because that antibody is present. So I think there are 2 to 4 of them that you check for IgM, and there are about 7 to 10 that you check. So the standard Western blot is okay. None of them are perfect because it depends on when you're getting tested. If you get tested too early, then you don't get a test. So if you get a tick bite at this point, it's going to take a while before your antibodies go up. So IgM goes up first, and then IgG goes up later and stays up, all right, from that point. So if you test here, it's going to be negative. The problem is this starts to wane, and over time, this will start to wane. So it gets negative out here. So your best is going to be, like right in here. So it's getting at the right time for it to test properly. The problem is most of these tests are designed for acute infection right at that specific point in time. That's where you get your best accuracy with all of these things. But most people are being tested for chronic infection way, way out away from that. So after a while, even if Borrelia is still in your system, you kind of have a truce between the immune system and Borrelia, and it ends up being in tissues deep in your body, and a lot of people carry it without being symptomatic. So these antibodies start going down. So when you're testing for chronic infection, the accuracy of the test for both of these things goes way, way down. So, but if you have all the symptoms of Lyme disease, like I did, and you do the test for Lyme disease and it's negative, you're stuck. And basically the definition that you end up stuck with is fibromyalgia, for which there's no treatment according to the conventional medical world. So everybody wants a positive test. They want to get a test that defines that they have a positive test for Lyme disease, because that might open them up to a treatment. So there are lots of companies that want to give people positive tests, and IGeneX is one of them. So what it did was, so IGeneX test has more bands for IgM and IgG, all right? So the good side of that is there's a higher probability they might pick up Borrelia. The downside of that is you might get a false positive test that Borrelia isn't even there because they've added these extra bands to boost the test. So they have a higher incidence of of um, of of false positives. So basically, it boils down to this: if you have all the symptoms of chronic Lyme disease, you got chronic Lyme disease. I mean, it's as simple as that. You got microbes. You may or may not have Borrelia, but you probably do have Bartonella and Mycoplasma and chlamydia and a range of other ones. So if you have all the symptoms of fibromyalgia, if you have all the symptoms of chronic fatigue, if you have all the symptoms of chronic Lyme disease, you do have a disruption of your microbiome and this tug of war that's going on with your immune system. There is no doubt about it. And you will not find, at least at this point in time, every single microbe that is part of that disruption. So, testing has value. I did testing. I did find a few of the microbes in the beginning, but later I just gave up on it because it was basically like chasing your tail. So the treatment is suppressing and restoring. It's suppressing the microbes that are part of this disruption, restoring balance in the microbiome, and restoring the ability of the immune system to function. So if you give me a choice between spending $600 on an IGeneX test or $600 on herbs that might get me well, I'm going to buy the herbs every single time. So I think you've got to be careful about how where you're putting your money. And again, these tests are most accurate at a very specific point in time. The more chronic you are, the longer you've been chronic, the less chance you're going to have a positive test. But even if you get a positive test, it still isn't going to change what you need to be doing to get well. So let's see. Will Dawn ask, should I be concerned about interstitial cystitis flare when starting the herbs? It's a common issue for me, and I often can't do treatments because of this. Interstitial cystitis is an overactivity of the bladder and pain in the bladder. And I did a lot of work with interstitial cystitis and vulvodynia when I was in my medical practice. And it's, I have come around to thinking that it probably is different species of microbes. I think ureaplasmas and mycoplasmas, not Mycoplasma pneumoniae, but other species of mycoplasma are part of it. There have been therapies that they've instilled different things that kill microbes into the bladder and gotten benefit. But very recently, this past week, I came upon a study that they found a species of E. coli, which is a really common gut microbe that's normally extracellular. They found that this species had learned to live inside cells. It had become intracellular, which we didn't know E. coli had done, and it was very prevalent in a patient with interstitial cystitis. And the thought was that maybe a lot of people that have interstitial cystitis, they have all the symptoms of a bladder infection, but not you don't have, your urine is clear and antibiotics don't get rid of it. Maybe these intercellular microbes. With the herbs, you may be just intensifying that reaction a bit. And I think I would probably focus on some of the herbs that affect ureaplasmas, mycoplasmas, because I think they are more common. Animu is a really good one for that. Animu is especially good because it's concentrated in urine. And there are a few others that are very good for urine. Berberine is very good. So maybe holding off on some of the other herbs and trying some herbs like Animu or berberine-containing herbs to try to affect the bladder just a little bit more, I think is a reasonable thing to do. So Let's see. I think we're getting down to our last questions here. All right. All right. Tanya, Scott, and Deb ask, what do you do to treat parasites? Do you recommend a cleanse? Parasites. Parasites. We all have parasites. Parasites are parasite is basically anything that is host dependent. So all viruses, all bacteria, all protozoa, all fungi are parasites. Technically, our normal flora are parasites. They have to have a host to survive. But what most people are talking about with parasites is intestinal worms. And our actual burden of intestinal worms compared to other times in history and other parts of the world is really quite low. I think occasionally we all pick up eggs from salad or other foods, certainly undercooked meat. You can pick up parasites, intestinal worms. But the thing about intestinal worms, the difference is bacteria and lower protozoa like Babesia are one-celled animals, where worms are multicellular animals. So they have a totally different life cycle, right? So parasite bacteria reproduce by dividing, all right, to get two bacteria. Parasites have to shed eggs, have the eggs hatch, go through a larval stage, and then come back to an adult. So it's a totally different life cycle. So if you eat parasite eggs, if you eat worm eggs or eat worm larvae, they hatch in your body, they go through this life cycle, they shed eggs out of your body, but they do not grow into new worms in your body. In other words, you can't have more worms from more worms from more worms, all right? So to do that, you've got to keep, to have a load of worms in your body, because eventually they'll just die off and pass out. So to have a load of worms in your body, you have to keep getting the eggs or keep getting larvae. You can get them occasionally from walking in the yard, undercooked meat, non-cooked vegetables. But most of those things have to be contaminated, and most of our foods that we're buying in grocery stores have a very low contamination rate. It's much higher in third world countries where people are eating on the ground or eating in unsanitary conditions, and there's fecal contamination. Then you get high egg and parasite loads. But researching this, I found that even in third world countries where people typically carry a much larger parasite burden than we do here in developed countries, that what was really that immune status was really key. People who had a healthy immune system didn't have a high parasite burden, where people that had a low immune system, were stressed, whatever, had a high parasite burden. So immune status was really important. So another thing just to keep your immune system healthy is really, really super important. But parasites, so one thing you can do is cook all your food, make sure your meat is cooked well. Toxoplasmosis, toxoplasma is something that you get from undercooked meat. Probably 70% of people have it already. It's in your system. It's another intercellular microbe that can cause all these same symptoms. Toxoplasmosis has been associated with everything from depression to schizophrenia. It likes the brain. So it's so all of these things are present, but it's so just cooking your food, eating a clean diet, all of these things are important. Keeping your immune system healthy. If you look back through history, most of the herbs that we're calling antimicrobial herbs were used most commonly for parasite loads in days where people did carry much higher microbial or parasite burdens than they do today. So a lot of the herbs were used for that. So andrographis, cat's claw, those are great anti-helminth egg. Also, in addition to being antibacterial, antiviral. The classic ones are wormwood, black walnut, and clove. There are a lot of products out there that have those ingredients. So there is, so those three are the things you find most commonly in products. But I think any herbs that you take long term, if you clean up your diet and do any kinds of herbs, then you're protecting yourself from a lot of these things. So that is that. And I think we're down to our last question to wind it up. Again, thanks to everyone for joining us. It's been a pleasure. We'll do these some more. Please give us your feedback. Let us know whether this has been valuable to you. And I know we didn't get to everyone's question, but we'll try to review the questions that were asked, and we'll try to address those questions in upcoming webinars and upcoming events that we do. There are going to be plenty of Facebook Lives that I'll try to go back and address some of these questions that I really maybe didn't get a chance to cover as thoroughly as I would have liked to. So even if your question wasn't asked, know that it was noticed. And we will try to get back to all of that information. Stick with us. We're going to have lots of great information for you in the future. Last question is from Kim Lewis. Is there hope for recovery? Absolutely. You know, it's as long as you're living and breathing, there is hope. And for me, it was making that transition that is so important from grasping for somebody else to save you to recognize that you have that capability. Every single person, as long as you're living and breathing, there is hope for you to make your situation better. And I think that's relative, you know. I mean, expectations from a 20-year-old are going to be different from expectations of a 70-year-old. But what we're looking for is quality of life. Life that is free of pain and discomfort. Life that we can do the things that we want to do, that we can have purpose. Because when it really comes around to it, purpose, feeling purpose in the world. Even if, you know, you see people that have pain, that have discomfort, that have disabilities, you know that they're putting up with a lot. And you see the ones that have come around to finding purpose. And when you start putting your situation in perspective, that it's secondary to your greater purpose for what you're on this planet for, then the symptoms start becoming less of an issue. For me, you know, I didn't expect to be doing all the things that I'm doing. It's I thought my career and life were done at age 50. You know, I had trained 8 years for a career in OBGYN, and 18 years into that career, I was done. It was over. And I had very little else that I thought I could offer to the world. But as my recovery progressed, I realized that everything that I was learning was really important, and I needed to start paying attention so that I could give that back, so that I could make it possible for other people to use the same information. So my purpose has been doing this, and it's been such an important part of my career that I don't think I would trade it for anything. Your purpose may be different, but I promise there is purpose. There is reason to keep at it. There is reason to be persistent. There is reason to keep driving forward. Because as you do that, you'll find your purpose. It'll start to unfold. So, well, thanks for joining us. We're going to wind everything up. Thanks for watching today. Be sure to subscribe to the Rawls MD newsletter. Lots of things that you guys are asking me, I'm going to try to address better. There's going to be webinars, blogs, videos, lots of information coming your way. And don't forget about this upcoming webinar. I've put more research into this upcoming webinar than any that I've done so far. I think it's going to be a really important one because it looks at how microbes, it looks at that connection between the brain, gut, intercellular microbes, immune connection, and how that drives symptoms like pain and what we can do about it. There's going to be a lot about CBD that I haven't talked about here, just to go a little bit more thoroughly into what's going on there. So I think it'll be well worth your while. So thank you very, very much for joining us.